So I'm thrilled to see that many of you have stuck around for our final segment. And as I sort of half joked at lunchtime, ready or not, the world keeps moving on with technology and how technology is impacting not just our culture, but how we connect with each other and how we do business. And the world is already moving on in terms of social media and artificial intelligence. We're going to do this last section as sort of a tag team, providing a little bit of a framework for social media from Sarah Idso. And then we have folks who are going to chat about implementing social media in pediatric practices to provide some perspective. And I think you'll find it sort of a useful wrap up for where we are today. And then we'll still get everyone out of here on time. So where's Sarah? There's Sarah.
Thanks, Mark.
And come out here for 1 second.
Yeah.
Sarah promised to be patient with us and not add to the pediatric population until after this meeting. So it's like.
Well, thank you, Mark. Thanks for having me today. I appreciate it.
Oh, thank you for
holding off.
Yeah.
Good afternoon, everyone. My name is Sarah Idso, and I'm an independent marketing consultant. Over the past 4 years, I've had the privilege of working with the PHN, helping to enhance their website and email marketing strategies. Prior to my work with PHN, I gained valuable experience in a range of healthcare marketing roles. I collaborated with healthcare networks, advertising agencies, and healthcare nonprofits. And I assisted them in a few capacities that you can see listed here. But today, I'm excited to focus on one of those areas, social media, and how it can play a key role in your practice, connecting with patients, families, and communities. Okay, so for today's agenda, we're going to be talking through 3 different things. First, we're going to talk about the state of social media and healthcare in 2024. Second, we're going to be defining a social media algorithm and talking about how you can use it to your advantage in your practice. And third, and this is really the heart of the discussion today, we're going to be talking about very practical tips and tricks that you all can use. And I'm hoping that I can give you a blueprint that you can take back and use at your practice. Okay, so for any skeptics who remain in the room about the use of social media in healthcare today in 2024, over the next couple of slides, I'm going to try to convince you with some stats that you do indeed need it. So you can see here that over 60% of the world's population is an active user on social media, and that the average user spends 2 hours and 24 minutes per day on social media platforms, a lot of the day. 80% of internet users report seeking health information on social media platforms. So that is not WebMD and it's not Google. That is specifically on social media. So platforms like TikTok and Facebook and Instagram. You can also see that 70% of people report sharing their healthcare experiences on social media. So that means that people are going to your practice, they have an experience, and they're posting about it for all of their followers on social media to see. And I think this stat is the most compelling probably for you. And that is that healthcare organizations that actively use Facebook report an increase of 45% to their web traffic and new patient inquiries. So if you're asking the question, does social media affect people's healthcare decision-making? The absolute answer is yes. So we are going to discuss at your table, really before we can even start getting into the nuts and bolts of social media, we have to talk about your purpose on social media at your practice, and also the very real barriers that you face when you're thinking about posting on social media every day. So for those of you who are at a table that's with a group, please go ahead and discuss for about 2 minutes, and I'll keep time. These 2 questions. First, what is your practice's purpose with social media? And what do you use it to accomplish? And second, what is a barrier you face in accomplishing these goals on social media? So I'll go ahead and keep time, 2 minutes. All right, about 10 more seconds. Make your closing remarks. So I did a very similar talk. It was a few months ago now to your wonderful practice administrators and practice managers. And we had a similar discussion. And some of the answers that they came up with that day are up here. So I'll let you sort of read through some of these. But I noticed that their purposes varied, and it really depended on the practice. So some of the purposes that people said were new patient acquisition. It was things like patient education and advocacy, advertising certain medical service, and things like that. There were also a few different answers about the barriers that your practice faces when it comes to posting, but they tended to coalesce around one answer. And that was this bottom one that's bolded here. And the answer was just not enough time. Social media can feel like it's at the bottom of a very long list of to-dos that your practice has. You all work for busy practices. You're seeing a lot of patients and you're pulled in so many different directions. What I'm hoping to do today is to be able to help you clarify your practice's purpose on social media so that one, it feels worthwhile, and two, so that it actually becomes more efficient when you're using social media and not such a time suck. All right, I'm going to spend just a couple of minutes talking about trade secrets that I learned working at ad agencies. Ad agencies are very different from working for one company at a time. Ad agencies are where marketing people go, where they get worked really hard, but you work with a lot of different clients. And that's the advantage. So I had large clients, small clients, I had healthcare and non-healthcare clients. And the advantage is that I could trial and error different tactics and strategies with all of these different clients and see what it was that worked and what didn't. And so today I'm going to take those years of working at ad agencies and distill it into 3 key learnings that I learned while I was there that hopefully you all can take advantage of. So the first thing that I learned was that social media cannot be successful if it's the only part of your marketing strategy. It cannot be successful on its own. So what I mean by that is that it has to work seamlessly together with your overall marketing strategy at your practice. So this is what we call a marketing funnel. It's the process of taking people who are strangers to your brand and turning them into advocates for your brand. And you can see up there that there are a lot of different strategies and tactics along the way. It's things like your website, your email, your direct mail pieces. And social media is just a part of that. So it's one of those tactics. I would have clients come to me and say, I've been posting on Facebook every day and it's not getting that much engagement. I'm not getting new customers. What am I doing wrong? And sometimes the answer wasn't that they were doing anything wrong on Facebook. It was just that they were only doing that. And it wasn't integrating back with what their messaging was in their direct mail pieces or on their email or anything like that. So this is sort of the first step, is making sure that you have an overall marketing plan for your practice in place, and then seeing where social media can fit into that. All right, so this is the slide where we talk about a social media algorithm, and that's where we got the title of this talk today, Beating the Algorithm. And this was the other key learning that I learned in my years at ad agencies. So how many people in this room have heard the term social media algorithm before? And keep your hand up if you feel like you could accurately describe the social media algorithm to the person sitting next to you. Okay, a couple of people. Nice, sort of. It's sort of used, it's a really often used term about social media, and not very many people necessarily understand how it works, but it's something that's valuable to understand how it works because you can learn how to use it to your advantage. So an algorithm is a set of instructions. A social media algorithm is a set of instructions that the platforms use to serve users more content that they like. So it encourages people to spend more time on the platform. And why? Why does the platform want to do that? Because they make money from ads. So the longer a user is on their platform, the more money the platform makes. because it's more ads that they're serving to them. So it's intentionally addictive. That is the point of social media. So the data that they collect on you is called engagement. And what they're collecting is things like an individual's user comments or likes or shares on a certain post. Even something as simple as if you have your phone up and you're scrolling through Facebook and you pause on a video for longer than a split second, it captures that data. You don't even have to press play. Facebook knows that you're interested in that content just by your pausing over it and hovering on it. So it collects that data on you, the individual user, and then it serves you content that is similar to that. So you've probably noticed that for those of you who are on social media as a user, you tend to get sort of sucked into it, and that's on purpose. So if you can use this to your advantage by tracking your metrics, seeing what it is that your followers like and follow, the platform shares that information with you, the business, and then you can create more content that is similar to that. Okay, and the third thing that I learned working at ad agencies was about the process of creating a social media strategy. And I will say that I have worked with a variety of different clients from big to small, healthcare and non-healthcare. And I would not reinvent the wheel every time a new client came to me and said, how do we implement social media strategy? We followed a blueprint, and that is what I'm going to be giving you today. So there are first a few things that you have to clarify. Your goals, audience, also your channels and your key messages. So we're going to go ahead and get into it. So step one, and I'm hoping that you take this back to your practice and use it as a blueprint, is to define your goals. So figure out what it is that you want off of social media for your practice. So here are a couple of examples of goals. It's things like increasing your web traffic by a certain percentage, increasing your email list signups by a certain number, promoting a medical service and increase that by a certain percentage. So you can see that these goals are specific and that they're measurable. And that is going to really help you when you are posting on social media to feel like it's worthwhile if you're able to know why you're on there in the first place. I wanted to highlight this last one, and this is the patient education piece. And that is because there is a lot of healthcare misinformation on social media. And yet, we know that so many people go on social media for healthcare information. And those of you who are in this room are the experts on pediatric care. Your voices are the ones that need to be heard on those platforms. So I hope that even though it might not directly impact your bottom line as much as some of the others, I'm hoping that every practice adopts this as one of their goals. Okay, so how do you go about defining your goals? Well, first, all of your marketing efforts should tie back to your goals. So that is one of the time-saving tricks. If it has nothing to do with one of your goals, if it doesn't tie back, then you shouldn't be posting about it. So if there's a viral trend on social media, and if it doesn't tie back to your practice goal, then you don't need to participate in it. And so it saves your practice time by giving you a focus, helping you to prioritize your to-do list and your budget. The second piece to this is including a call to action. And that is, in your post, if one of your goals is to increase your email sign-up list and trying to get patients to sign up for your email list, go ahead and explicitly say that in the post and make it really easy for them. Give them a link for how to do it. Make it as few clicks as possible between them and whatever your goal is. And just really tell them what your goal is, what it is that you want them to do. And you'll see a lot more engagement on those posts. All right, step two is to define your audience. So the way that we would do this is that we use fictional profiles that we create for your ideal customer, your ideal client. And these are what we call buyer personas. So it helps to give you a deep understanding of your ideal customers, learning about what drives their decisions more. So this is an example of a template that we would use. I've actually linked to it, and these will be posted online so that you can visit HubSpot. It's got a bunch of these different templates, but these are all fictional characters that I hope that your practice creates a few of these. You can see that they've included a photo, they've made up a name for this person, they've included things like their demographic information, and this is all fictional, remember. This is not a real person. But they've also addressed things like what are their problems and how can your practice help them address some of those problems? That's a couple of the bigger things. They also post on there things like what are the social media channels that they use the most of. So with these, what I'm hoping that you can do is develop 4 or 5 of these and get as specific as possible with their age, their income, demographic information, and things like that. And if there are a couple of questions on there and you identify gaps in your knowledge of what it is that you don't know about your ideal client, that's a good opportunity for an anonymous survey. You can find out more about the people you're trying to serve and find out, for example, what social media channels they're on and things like that. I do have to give kind of a risk warning here. This was always easier with my non-healthcare clients because you all deal with HIPAA. And so all of your patient information is protected. So it's that much more important that you sit with these fictional profiles, make them fictional, so that you have a deep understanding of them. For other clients, I could actually take their real client list, upload it to Facebook, and it would create a lookalike audience for me. So it would give me other people who match that demographic information, and I could target them with ads. But that is not true for your practice. You can't do that because of HIPAA. All right, and step 3 is to identify your channels. So I've been using the words platform and channels interchangeably, but this is what I mean by those. So it can feel overwhelming to try to decide what platforms and channels you should be on. There are so many, it feels like there's a new one every day, and especially a new trending one every year. And I'm gonna make it really simple for you. Facebook. You have to be on Facebook. If you only choose one platform to be on and to spend your time on, this is the one. And why is that? It has over 3 billion users worldwide, and 50% of them are parents. And second, around 89% of hospitals actively use it to engage with their audience. So hospitals have the budget to do market research and to find out where their audience is. And they've done it, and now we know they're on Facebook, so you all can just use Facebook. All right, case in point. I mentioned I work for ad agencies. I also used to work for an adult hospital in the Midwest. When my husband was in medical school in the Midwest, we lived there. And so I worked for the adult hospital there. And this is a screenshot of, I think, probably the most successful post we did during my tenure there. And it had over 300,000 people who it reached. And the city where we lived had a population of 550,000 people. So you can see that it reached over half of the city. And that was our ideal audience. And that would not have been possible on any other platform besides Facebook. The other point I want to make with this is that this major hospital had a budget and a full-time person whose job it was to post on Facebook. That was my whole job there, was looking for stories and posting on Facebook. So it's clearly a budget priority and worth the while. If you want to do more, if you want to be on a couple of additional channels, these are the ones I would recommend for your practices. And this is really only if you have someone at your practice who's interested in these things. So the first one is Instagram, partially because it integrates so nicely. It's owned by the same parent companies as Facebook. So if you have somebody who's really good at photography at your practice, this is the other one that you want to be on. The second is YouTube. If you have somebody at your practice who's really good at making short videos, this is another good one. And then LinkedIn, which you can use for B2B purposes. This chart just shows, further proves that point. So you can see by far the most people are on Facebook, and then it's followed by YouTube and Instagram. So these are the platforms that healthcare organizations are using the most. All right, so the talk that I gave to your practice admin was about an hour long. I have 20 minutes today. So I'm not able to cover all of the information that I was there. But what I have put together is a social media and healthcare blueprint. It's a document. I'm happy to send it to any of you who are interested. But it's really sort of a template that you can take back to your practice and use to get this conversation jump-started. So come find me after the conference or my contacts at the end here, but these are some of the things that I go over in that. I provide a lot more post examples, popular topics, how to outsource social media effectively and things like that. I think I have time to go over our key messages here. So I'm going to talk about this, and this will be the last one. So step 4, the last step, is defining your key messages. So you want to keep 3 to 4 consistent, actionable, and patient-focused messages central to all of your campaigns. And what these should really do is emphasize your differentiators in the marketplace. So you want to make sure that they're addressing that. And then you want to use facts to ladder up to or prove those key messages points across all of your posts. So these are a few examples. Another one, so the hospital that I worked for in the Midwest, it was the only academic medical center in that city. And so all of our posts had sort of an academic tilt to it. So we were posting a lot about research that they were doing there. We were posting about clinical trials that patients could enroll in. So think about that thing that makes your practice special. And that is what you want to be driving home in all of your points, in all of your posts. I don't think we have time for this part, so I'll just leave these for you to discuss at your practice instead of at your table. So what are 3 key messages that set your practice apart? And what key facts can you use to support those? And then how would you use those facts to create a social media post? And again, in the blueprint that I created, it goes into a lot more depth for this. So you can access that blueprint from me. I have an email list sign up if you'd like. You're welcome to come and find me afterwards. Otherwise, feel free to email me at this email address. I'm going to go ahead and introduce Scott from Social Cascade, and he will be talking more about social media and their key learnings from pediatric practices. But thank you all so much.
Good. Yep. Social media 1, social media 2, social media 1, social media 2. All right. Good afternoon, everyone. Afternoon. Boy, we need some sugar. Let's see. All right. So thank you, Sarah. Sarah had a great introduction about social media. I am Scott McQuiggan. I'm a co-founder and CEO of Social Cascade. This is the last time I'll say Social Cascade. If I do say Social Cascade again, you all need to boo me because I want you all to get your CMEs. All right, so just want to quickly recap what Sarah summarized, and then as a way to help frame up to the rest of my talk, which will be around finding, guiding, and keeping happy patients and how social media plays a role. So as Sarah mentioned, this is where patients are. One of the most outstanding facts, I think, is that on our phones, the phone in your pocket, on average, we have 25 apps on our phone. Of those 25 apps, you're going to open up 5 of those every single day. And one of those, guess what it is? Social media. That's right. And just like Sarah said, we're spending 2 hours and 24 minutes a day on that app, and it has become a top source for healthcare seeking behaviors. And that's a derivative of, it's not just a top tool for seeking healthcare behavior or health information, it's a top tool for seeking information. And this is a shift that we're seeing, and this is something else I'll share more about throughout the talk too, is how our online behaviors have shifted from just the world of Google to social media. One of the things we'll also touch on is just how people are exhausted in general and how they're looking for local content. I have a picture up here of a car accident, and I hope you're all wondering why. This is a real world example, right? So think of a car accident. We've all experienced onlooker delays where you're driving past this car accident and we're hardwired to slow down, to stop and look at it for the emotional responses that we have, the fight or flight risk. And that pause is something that Sarah mentioned that these platforms have become really good at capturing. They're recognizing that pause that we see when we go by something, and they used to think, oh, you paused, you must like more of that. What we're seeing a shift in the algorithm is moving away from you just pause to thinking about where is the social capital within your social network on this platform that we need to prioritize. One of the things that's been trending lately is more local content. So we have gotten more local on our vast social networks, on Facebook and Instagram in particular. So now local trustworthy content is rising to the top as a top source, and I'm getting a lot more accidents in my social media feeds as a result. One of the reasons that we want to talk about that is because this is the thing to take advantage of. Healthcare providers, pediatricians, you're the most trusted source in all of healthcare. We've seen, starting from the bottom, other organizations, other entities in healthcare show up online. They have the budgets, the bandwidth, the resources, the staff to do so. But they're not trusted. Media is not trusted. We even go up to the hospital. It lands as a 45. This is the Edelman Trust Barometer, by the way. Hospitals themselves only go up to 45. And they're using one-size-fits-all messaging in most cases, right? They're trying to speak to your patients from one source, from one Instagram account or one Facebook account. But what we know is the most trusted source is healthcare providers. Oftentimes where the most trusted source that is showing up online maybe is friends and family, maybe is a source of a lot of the misinformation, disinformation that we're finding. So taking advantage of this rise of local trustworthy content bubbling up in the algorithm, healthcare providers being the most trusted source, this is a huge opportunity to educate and empower patients. And also combat misinformation. So misinformation, there's been a rise of the influencer. We've all heard the term influencer. We've seen influencers say things like what you see up on the screen, that sunscreen is bad. With the rise in local content, we're seeing the rise of the micro-influencer. So who are, again, the local trusted capital within our social networks that people trust? That's you all, the healthcare provider. And that's why the Surgeon General has called on healthcare providers to show up online to combat misinformation. The next part I'm going to talk about framing, using the framing of find, guide, and keep, which is really, let's talk about three particular areas of the business of pediatrics. So focusing on patient acquisition, patient engagement, patient retention. And we'll start with find. So it used to be, for somebody to find your practice, you had to show up in these books filled with yellow pieces of paper. Does everybody remember what those are? I see some people looking at their colleagues saying, I don't know what this is. This is the yellow pages. You had to be in the yellow pages for somebody to find your practice so they could call your number to schedule an appointment. Then that shifted, right? Late 90s, 2000, you had to have a website. You had to be in the yellow pages and you had to have a website. About 10 years ago, the iPhone came out and your website had to work on mobile because no longer were we using these big giant screens. We were using the little screens in our pocket to find our information and our healthcare providers. Now your website had to be mobile. We are now at a time where phone numbers change, addresses change. The one thing that never changes is your social media login. Social media is the place to be found. This recent article just came out a couple weeks ago in the Wall Street Journal about how Google's dying, right? The rise of AI has led to Wall Street Journal calling Googling old. I still Google every now and then, so I take a little offense that Googling is old. But what's important is when we Google now, Facebook content is part of the search results, right? AI is changing the way search results even show up. If you Google something now, you probably get that AI summary. Now results are pushed even further down the page. And what's happening is that younger generations aren't even going to Google. They're going to search right on the social media platform. So when they have a question that they want to answer, they search for it on Instagram. They search for it on YouTube. They don't start at Google and hope to find your webpage. They're finding the content right on social media. You've all probably heard about SEO because I'm sure the folks that help support your website have told you how important it is and how you should pay them lots of money to make the SEO better. And SEO is important, it's true. But showing up just by being active and participating on social media now is going to help that SEO, and it's free. Here's an example. So I want to give you lots of examples as we talk about this Find Guide Key. This is Bloom Pediatrics, different Bloom Pediatrics down in North Carolina. This was a brand new practice. She had a 3-year business plan on how she was going to grow her patient panel to 1,200 new patients. She did it in 1 year. And she did it because she was active on Facebook. And what happened is what you see in this picture. Moms would go into the mom groups on Facebook and say, "Who's your pediatrician?" They would say, "Oh, I go to Bloom Pediatrics." They'd click on Bloom Pediatrics. They'd see an active social media presence. And it quickly became oh my gosh, this looks fantastic. I want to go to this pediatrician. Oops, there we go. Similarly, we actually ran a survey with 275 parents. We showed them a typical social media presence for a pediatric practice, which means it was sparsely populated. It had 1 or 2 posts every now and then. It wasn't posting every day. It wasn't a full-time marketing person that was running the social media feed. And then we compared it to a very active social presence. And we asked those parents, simply just looking at the social media feeds, which practice are you likely to choose? No surprise, the active social media feed wins. Now, quick discussion at the table. Thinking about that same scenario, think about your own practice maybe, and how often are you posting on social media? Maybe you're part of a healthcare system and you don't get to post on social media at your practice. Maybe you're kind of on that, we call it fits and spurts. Wow, I messed that up. Fits and spurts posting, where you're posting once or twice a month. Maybe the last time you posted was Happy Thanksgiving, as an example. Or perhaps you're posting every day. How do you think patients would describe your own practice based on your social media feed alone? What are some words? Shout them. Go ahead and just shout them out. Professional. Welcoming. What was that? Informative. Nice. Kind. You guys are good. Funny. They care. Yeah, excellent. Very similar to what we found with an active presence, right? So in the one that was sparsely populated, I think these ended up being a lot of pictures of from in the clinic. And so parents were describing it as clean and welcoming because it had a picture of a Christmas tree, I believe, posted hanging there in the clinic lobby. But then on the active feed, you see these words that you all described that you really want, right? You want parents to feel like you care, because you do. You want them to feel like you're supportive, because you are. And you want them to recognize you as an expert, because you are. And social media is a way to reinforce all of that between those office visits. This is a clinic right here in your own backyard in Maryland, asking exactly the same question. And this is the word cloud that came from their patients and their following after they implemented a very active social presence. This is how their patients felt about their clinic. So that's really thinking about patient acquisition, showing up, helping get those referrals, right? Helping people recognize that you're not just nice and clean as a practice, that you're caring and supportive and an expert. So now let's switch. I'm going to go to the end and go to keep, which is going to be around patient retention. Patient retention is all about extending that positive in-office experience online. My own daughter has a January well visit. So we get to go every year in January, and we get to talk about what's going around. So right now, I'm sure we're going to get to hear a whole lot about walking pneumonia, which seems to be up and down the East Coast. What we don't get to talk about in that January well visit is sunscreen safety. She also has asthma, so it comes up a little bit. We check in on asthma, but it's not allergy season, so it's not the spring. So we're not talking deeply about what her allergy symptoms might be like and how that's affecting her asthma. But our pediatrician posts every single day, and she posts timely relevant information. So when it becomes seasonal allergy time, we see a lot more information about asthma. When allergy triggers are high in our community, she shares more information about remembering to take rescue inhalers when you go to swim practice. And then it comes in the summer when we last saw our pediatrician in January, and we get those good reminders about the importance of sunscreen safety and combating those influencers that say sunscreen causes cancer. The other reason we think a lot about retention, right, is we know retention is important. It's going to save the business a lot more money than trying to find a new patient to replace the one that just left. The other thing we're seeing a lot of, right, is the change in competition. You have these big markets maybe that are moving into your community, and you're having some patient leakage for certain types of appointments in particular. What's interesting is these big companies have big marketing teams. They have big budgets, but what they don't have is the knowledge of your community. This is where you win. When we go back to the beginning about what's changing around social media, about local, trustworthy content, this is where you win. This is where you beat the big brands that you're going to have to compete with if you're not already. And just to come back again, remember, CVS, my local CVS, is not active on social media. CVS is active on social media, but it's not relevant to my community. Being timely, being relevant to your local community on social media is what leads to numbers like this. Another example, this is a neat one where we have a large health system in North Carolina, Novant Health. They have clinics all across the state. They're headquartered in Charlotte, North Carolina. Winston-Salem is about an hour-and-a-half drive from Charlotte. Geographically diverse, demographically diverse from Charlotte. And the clinics here were not getting marketing support that they needed from headquarters, right? Competition was moving into town. They were leaking patients. They turned to social media. And they said, how can we use social media to keep our patients engaged? Does keeping our patients engaged have a return on reducing that leakage? Well, short-term measure, they were able to measure that they definitely increased patient satisfaction, and anecdotally have said that it has stopped the leakage or slowed the leakage to a drip, I believe was their direct quote. What we know as competition rises is that you have to stay top of mind for your patients. There is no better platform to stay top of mind than social media. Turning to patient engagement, thinking about guiding patients. Now that you're this trusted source and you're posting regularly, it's a fantastic opportunity to make sure that patients are hearing the things that you said in that well visit 6 more times. When parents walk out of the well visit, I know I'm guilty of this. I forget 80% of what my pediatrician said because I didn't write it all down. But seeing posts that will remind me of things that she did mention in that well visit is really helpful. Seeing posts that are timely and relevant to what's going on and going around is helpful to help me hear it 7 times so that it sinks in and results in that behavior change that we're all seeking. The other thing that's about guiding, and this goes back to how do you compete with some of those big boxes too, is you know your community. So you know what language to use. There's some really interesting results coming out of some work that we've done around what word to use, right? So we've looked at the word immunization versus vaccination versus shot. And it's different from community to community about how each word performs in a social media post. So knowing your patient population and thinking about the terminology that you use, the words you use, the language that you use, the imagery you use, only reinforces your ability to better connect and keep your patients engaged with you and your practice instead of those big brands. This is also an awesome opportunity, as Sarah mentioned, to really think about how do you drive social media towards those clinic goals. So if you have those quality metrics, those value measures that you're trying to increase, like an HPV vaccination rate, this is a great opportunity to remind parents about the importance of it. If you're in a community that has high vaccine hesitancy, great opportunity to put out great information about why vaccines are important, why they should consider each of their vaccines, remind them what vaccines to expect at each of the well visits coming up. And the best part is all of this information parents love. So from another practice here in your backyard, an example of a post, funny enough, about sugar, and a parent saying, thank you for sharing this. This surprised me. Parents can learn from you without being in the office, and social media is the platform that you can use to make sure you're delivering that content to your parents and families. This is some interesting data just to reinforce the engagement. So this is going back to Novant Health, looking at how their social media changed over time and just how much parents were hungry for this type of content. So Novant Health, over the course of a year, had a fairly sparsely populated social media feed. These are Instagram and Facebook posts over the course of 9 months. And it performed just about that industry average engagement rate. So 1 to 3% of the folks that saw posts were going on to like it, share, comment on it. When they became an active social media creator, when they became a micro-influencer, their engagement shot up. Parents were hungry for this information. They were sharing lots of patient education content, keeping their parents engaged between those office visits. And this is what led to that increase in patient satisfaction. And so what we actually saw was there was a correlation between the increase in patient engagement in social media and the increase that they saw in patient satisfaction. The best part is it works. It turns out if you hit somebody on the head 7 times, they learn that you hit them on the head 7 times. So in this same survey, we were doing measuring some perceived message, looking at perceived message effectiveness as a proxy for actual behavior change. And what we found is when you talk about vaccines or you talk about how to use the ED versus urgent care versus your pediatric primary care office, it resonates with folks. This information is what they're looking for. They remember it, and it's likely to affect their behavior when they see it. Hopefully, if we show it 6 more times to them, it will actually impact the behavior. And there's some neat work coming out of a top 5 children's hospital, a little north of here, that has some neat work that actually showed some use of talking about ankle sprains on social media, reduced the number of ankle sprain visits to the ED, because they talked about how they could use when to use an urgent care versus primary care for an injury such as an ankle sprain. Reduced ED visits by 33%. Looking forward to that becoming increasingly and widely acknowledged. So to summarize, social media is the platform to find, guide, and keep happy patients. Being active, beating the algorithm, showing up 4 or more times on social media each week is what enables you to reach your patients with the messages that you want them to see the most. You're already an influencer. You're the most trusted voice in all of healthcare. Showing up online will just lead to you being the biggest, best micro-influencer you can be, serving your community and your population. You all are a hub of information. I try to consume 100% of what my pediatrician says in the well visit, and I'm so thankful she's active on social media so I can get those reminders throughout the years. As we've talked about the type of content to go out, we've talked a lot about patient education. The other thing that's important is to make sure that you're humanizing your practice. Be authentic, tell your story, and show up too. That's your brand. That's why folks are choosing your practice and coming back. And last point is just while this may sound overwhelming, I think, for what Sarah and I have shared at times, the content monster that you need to feed to make social media happy is a real beast. And there's tons of tools that are out there to help you solve this problem and make it easier for your practice. I'm Scott McQuiggan. You can contact me at this email address, .co. I didn't say it. And I'm happy to help you evaluate different tools that can help your practice become an active participant on social media and be the micro-influencer you already are. Thank you.
I guess the other thing you mentioned, but I think it's just important, much of what we do with our families as busy pediatricians and pediatric practices is we develop a relationship. And in many ways, what's different than adult medicine is many of us have the opportunity to see new babies at birth and watch them grow up. It's really a long-term sort of relationship. Families move, people come and go, but for many of our practices, newborns and new babies are a pipeline for not just new patients, but a successful practice. And in case you haven't noticed, new moms, especially, but new parents talk to each other a lot and they compare a lot of information and there's a lot of networking and communication going on. It is highly social. It is not always involving our pediatric practices. And I think Lucy and Scott are sort of able to sort of demonstrate that there are ways for us to begin to establish social network connections and hopefully some ongoing engagement with families so that they feel like it's home. There's no place else that they would go. You are trusted. I think the other thing is new families and new babies, they see us a lot in the first 2 years. Lots and lots of visits. And there's an opportunity in person to sort of establish as well as reinforce relationships. But what happens after the second birthday? Kids shift to annual checkups, if that, and there's definitely a subset of kids who are coming in with acute minor illness and chronic conditions and whatever. But, we are sending a lot of reminders out to families like, oh, you haven't been here for an annual visit in 1 or 2 years or whatever. So there are families that become less connected, disengaged as the years go by. What would happen if actually we were able to better engage and build a more ongoing relationship by leveraging ongoing information sharing and communication via social media? I think it's really important to recognize that while we may not be on it, your families are on it. And this is a way, it's not simply marketing. It is really about building another avenue for a relationship with your families that goes forward. And so I think it may be, some practices may be doing great work in this space. Other practices are going to be sort of brand new to doing that, but our parents aren't, our new families aren't getting younger, we're getting older. And this may not be a space that we're as confident or comfortable in, but they're all over this space. And I think beginning to develop the awareness and expertise and beginning to sort of leverage this as ways that can help you all as pediatric practices, not simply share information, but begin to build engagement and trusting relationships in a way that keeps the patients that you have, and via word of mouth helps you get more new patients down the road. Any questions for, did I misstate anything there, experts?
That was fantastic, Mark. Thank you very much.
Any other questions? Scott and Sarah are available. We can connect you all if you have other questions or those sorts of things. But we appreciate all of you young kids out here, you know, listening to where the world is going in terms of technology and relationships and engagement. And we really sort of value that and appreciate that. And I think we're going to move into any last comments that either of you would like to make? Like,
I think you covered it. Thank you.
we are at the end of our program, so permit me one or two final remarks. We still got a thing here. One is we did host this little raffle or drawing for $100 Amazon gift cards, and the winners are Dr. Oma Lola Johnson from Complete Healthcare and Dr. Amazu from Rose Pediatric Care. And if you are not here, we will push these to you electronically. And we appreciate all of you visiting our exhibition hall and meeting with the vendors there, whatever. And because that actually helps build this as well. All right, last words. I don't have the cash in my pocket. We're going to email to you. No, we're sending you gift cards. Yes, all right. So they send to you electronically. I don't have them. Your check is in the mail. $100 gift cards to Amazon. So thanks to all of you who participated in our raffle. You can see I am not Alex Trebek. I cannot pull this stuff off. It's like, all right. So this year's program has been hosted by our Pediatric Health Network. We want to thank all of our presenters. We really had a great group of presenters this year. And even better, we had a great audience. Thank you all for being here, and to our planners, our partners, our presenters, our exhibitors, all our staff. You don't need the parking tickets, just approach the gate. All these presentations will be posted online by next week, so you can see the presentations, you can share them with your colleagues, you can get CME credit for within 60 days. You have to sign up at Children's. The information on the CME should be on the back of your agendas. There's the CME announcement. We want to thank you most of all for the care that you provide children, families, and each others. And thank you. We are done. Thank you so much for our 27th Business of Pediatrics.